Hi everyone, welcome back to Real Talk, our campus weekly video series where we discuss relationships, empathy, advocacy, and life. All of our episodes are pre-recorded and released every Tuesday at 5 p.m. on our IGTV and Facebook page through a YouTube link. So as you may have noticed, we have a couple hopefully familiar faces now at this point. So Sydney is joining us again because we did a part one of a sexual health episode with our sexual health expert, Jasmine, who has joined us again tonight. So thank you so much again, Jasmine, for being with us. And we're excited to do a part two of sexual health because we thought our part one was really fascinating, fruitful conversation, and realized we had so many other questions and things we wanted to get to. So we're really excited to get into part two today because we can't get enough of talking about sex. So let's get into it. So for anyone who has not seen our part one, you can see it on our IGTV, but Jasmine is a sexual health educator in the state of Florida. So she's not a Connecticut resident and not up north with us, but doing all of the stuff down there to educate the kids and the peeps on these important things. So today we're going to talk about a few different things, and I thought it would be cool for us to start the conversation with our kind of what we received as sex education growing up. And I think a lot of us grew up in different areas. I know some of us obviously all in different areas of Connecticut and Jasmine in Florida, but it would be really interesting to hear like what your school taught you, what our schools taught us about sex ed, and then compared to kind of what is being taught today in different schools, where are the kind of gaps in knowledge and how that's impacting people and their sexual health. So would anyone like to start with what they kind of grew up learning in sex ed in middle school, high school? I know, it like takes a second to think about it. Get yourself back into that.
I went to a private Catholic high school, so we learned nothing about sex ed in high school. We learned nothing of the sort.
Wow.
Yeah, I took like a health class in 5th grade, which was like, what is sex? What is your period kind of sex ed? And that was separated like boys and girls, and parents had to sign like permission slips to let us go to class. And then I took health class for sure in 8th grade, I think maybe 7th grade too, which was also where we learned about like drugs and alcohol and all that kind of stuff. And like sex ed was like a blip on the radar, but then I got to high school and it was like crickets.
Wow. Did you ever learn about consent? That was one of the things I was always curious about too growing up, like what consent was or a part of that conversation.
Having done this work, I've tried to think about that a lot, and I don't have, my memory is like awful. I really can't even like tell you about the 6th grade, like just in general, like so much very specific things I struggle with. But I don't remember, I was an RA in college in my undergrad. So we did learn about consent, Title IX, all that stuff, reporting assault and things like that for RA training.
And that was in college by that point.
That was in college, yeah. But I don't think that I don't remember ever learning about consent.
Yeah. Wow. Thank you. Enlightening. I'm so interested. This is great.
Yeah.
Anyone want to go next?
Well, in Florida, I remember like 5th grade getting like the period talk.
Yeah.
And you're separated from boys and girls, and it's like a period / like personal hygiene combo they give you here in Florida, and it's like a 45-minute class that's like you're gonna get your period and you're gonna start to smell like something that's not kid sweat, so here's deodorant so people will like you, and you're like, what? I don't remember getting anything in middle school. I remember like my PE classes were definitely more physical health, which is great, but they didn't really do much of anything else. And then in high school, Florida has a class called Hope, and don't ask me what it stands for because I forget. But I was in the IB program in high school, and because you fall into this, different academic program, they feel IB students don't need to take Hope, which has a very small section on sex ed, but still it's, part of the curriculum. But being an IB student, you no longer take Hope, and you also don't take PE anymore. So, and in place you just take like biology and things. So I remember my senior year, we did what she said, sex ed. And essentially all it looked like was taking different sexual health disorders and making a report on them. So, how old was I? 17-year-old Jasmine was like, oh yeah, let's do this on erectile dysfunction because that's funny. And that was my sex ed experience. And I remember like one of my friends brought in like a wooden peg to do like a condom demo, and it was wrong because she's also 16, 17, and she's just like, this is what I found on the internet. And then we're just like, you can take Viagra, and like the very, very sciencey aspect of erectile dysfunction. And that was it.
Did you ever learn about consent? Do you remember?
You don't learn about consent. So consent, when you look at policy for sex ed, there's only a few, I want to say 12 or 13 states that require consent education as part of their sex ed, and Florida is not one. Florida also does not require sex ed to be medically accurate. So there is a whole lot going in there. So no, I didn't get any of that. Consent, yeah, I got in college, working in like the residential housing and that kind of aspect. I worked doing different leadership programs. And that's how I first learned about like the word consent. I think my mom always told me like, no means no if you don't want to do something. But like hearing the word consent for the first time, I don't think was until college. And it was still really fuzzy, right? Because college people, they're trying to shove so much down your throat. So yeah, Florida.
It's interesting though that even two totally different parts of the country, and so far even kind of similar like themes of limited conversations, limited knowledge, and especially not including consent is really interesting to me.
And also incredibly like heteronormative. Like I'm certain that they were not teaching anything other than like penis, vagina, like that's how you make a baby. Sex.
Right. Yeah, interesting. Holly, do you want to go next or do you want me to go next?
I can go next. So in 5th grade, we got separated the same way you guys did, with the boys and the girls. And I remember the boys coming out and they were like, I heard you guys have candy dispensers like in the bathroom, because the male teacher told them that's what like the pad and tampon machine was. They were like, oh, the girls get candy dispensers. And I was like, so I think I was the girl who like broke a few guys' hearts and was like, no, that's for when we bleed.
For our vaginas.
I was just like not having it. I was sick of the guys being like, you get candy. And I was like, no, we don't. We get torture. Like, what do you mean?
We get torture.
But like, we didn't learn about like sex ed. Like, it was mostly just learning about, very similar to Jasmine, like, you're going to start to smell. Please wear deodorant. If you have like your boobs coming in, please wear a bra. But like make sure your straps aren't showing, like distracting. And then in middle school, so Farmington, where I grew up, there's different elementary schools. So we have an upper elementary school, which is 5-6. Then we have middle school, which is 7-8. And then we have high school, which is 9-12. So upper elementary, you do the like boy-girl talk. And then you kind of talk about the birds and the bees in 6th grade, but like very light, nothing crazy. And then in 7th and 8th grade, we did a little more sex ed, but it was more about like how the body works versus like what would be going on. And then in high school, we learned about like the different STDs. And I remember us watching Philadelphia for HIV and AIDS. And like my teacher was like, this just shows a really great depiction of it. And in high school, I was like, it doesn't. Okay. And And then when we talked about sex ed, like they were very frank with us. They were like, this is what's going to happen. These are the different kind of condoms you can use. Like they went over the female condom. They went over the male condom. They went over different contraceptives. They went over like the dental dam. There was a bunch of them that they went over. And they also brought up like different clinics near us. Like Planned Parenthood was brought up. Planned Parenthood was brought up by our teacher. I don't know if she was supposed to. One of those things that was because Planned Parenthood was like the bad guy in our town. At least like in
People
our
saw
town.
it that way, yeah.
Yeah. And so she brought it up as like, you can go here for services, and it's not just an abortion clinic. And kind of gave us that, but like that was it. And then we did a lot of like drug and alcohol education too in high school. But as far
And
as
any consent?
So for consent, they didn't really talk about consent. They talked about like sexual assault. They didn't talk about like what it would look like to healthily say yes, but they would talk about what it looked like when things went bad.
Of course.
So I was like, okay. And now looking back, I'm like, we missed a prime subject there, but it was, I feel like we had a pretty good understanding of like how sex worked and like what you're supposed to do and when you put the condom on and stuff like that. But it was very heteronormative. I think there was 1 or 2 discussions on like what you can do to stay safe if you're not in a heteronormative relationship. And I think like when they showed Philadelphia, that really like turned people away from things. I don't know. It was an interesting way to teach it. I'm not sure if they changed it though.
Interesting. Yeah, that's so interesting. I feel like I have similar experiences to all of you in that most of the sex ed that I remember growing up was around STDs. Like that was like, if you were going to health class, you knew you were going to see graphic images of like diseases and like basically they weren't teaching abstinence or anything like that, but we never talked about consent. I don't think we even talked about sexual assault at all. And it was really centered around like the physical health aspect of sex and anatomy. It was like all about learning the anatomy. We got quizzes on like naming all of the different parts of, genitals and things like that. But condom day, like when we were learning about condoms, it was 1 day of class and I went on vacation or something with my family. So I missed that day and never got that knowledge. Like it literally was 1 day. If you weren't there, if you were sick, if you were on vacation, whatever, you didn't get it. And I think that was also like maybe junior year, something like that of high school. So like it wasn't even a conversation before that point. And then, I didn't learn about consent or anything like that either. And I think the reason, obviously, that I find that piece particularly fascinating is like, I don't know if people still, and this is something I'm curious to hear from you, Jasmine, with the students you work with, the kids you work with, and parents of the idea that like, oh, our kids aren't having sex, our kids aren't doing that. Like, I think that was still an attitude and maybe still is today, which is just so ignorant and like, very in the dark about like what's happening. And some kids obviously like may not even explore sex or sexual acts until college or ever, like whatever, a lot of kids are asexual and may not even know how to identify with that because it's not talked about. So anyway, I think that would be a good next place to go is to hear from you, Jasmine, about like what is being taught. And obviously you can speak mostly through the lens of like what's being taught in Florida, but I'm sure it sounds like we had similar even in totally different states.
So it's interesting because I would love to say like this is what's happening in Florida and whatever, but so the way that the federal government has kind of set up sex ed, right, is so you have multiple different outlets of who can apply for like funding or different things like that for what they want to teach, right? So the federal government is abstinence, right? So then within that little bubble, states can kind of decide if they want to use that guidance. And then if they do, they have to fall within like certain requirements under that, right? Because if they use that money, then they have to adhere to those requirements. And then, Florida is a big place. So I will say under like the federal dollars that we have, there's not many, at least school districts that have funding from the federal government for this specific thing. So that's where it gets tricky, right? Because Florida says, it is Florida statute to teach sex ed from a heterosexual married relationship standpoint. That's in Florida statute for schools.
Yikes.
Right. And then within that, you've got school districts can decide how they want to approach that. And then another layer is then, okay, school district, this is what we allow. Principals decide how you want to execute that. So you have so many different people who, there's so many different layers of, okay, yes, this is allowed. Now you choose what you want to do. Okay, this is what we've chosen. Now you select what we've approved. So there's so many different layers of people deciding what's allowed and what's not, that then of course it gets lost, right? And then the statutes can be so vague. Right? So then you have science teachers who are like, oh, okay, well, I taught biology and we did, naming all the pieces of the genitals, they got sex ed. And I'm like, I'm sorry, just because you know where the vas deferens is does not mean you understand sex. Really important and super awesome. And I'm kudos, like 10 points if you know what a clitoris is. But that doesn't really help us, right? So it's really interesting. So I will say in our district, at least 6 through 12, a really good number of students get my program. But, so again, based on the district, teachers rather have the option to use my program, but they don't have to. Right. So there is a portion of teachers, especially in my middle schools, where students don't get the same info. So if that teacher wants to show, that PBS documentary from the 90s about sex, they can. It's checking off all the boxes. If they want to teach from the biology textbook standpoint, it fits the box. And we see a lot of that. And then, there's also no way of tracking schools. So that's something that I'm working on with the Department of Education here, is making schools accountable, right? There's no system in place right now to be like, what are you doing for sex ed? For them to say something, it's like, okay, show us. Right. There is no system, so they can have it saying, yes, students will get HIV education, students will get sexual health education, which are two different things in Florida statute. They're not the same. So they're allowed to only teach on HIV only, and that's it, or they can do sex education, which whatever. So we're working on the system now to make school. Well, that's a different conversation. I'll tell you.
We'll get there.
I'll tell you who did it. But yeah, it's so weird, so if the students get our program, they do get a pretty comprehensive, medically accurate program. There's no condom demos because that is Florida statute of a big no-no. Or not Florida statute, I'm sorry, Sarasota County schools. So that's a county thing. But they get comprehensive as far as like a full HIV and AIDS education. They get STDs, they get pregnancy, they get consent only because it's added. We added that to the curriculum. Like I said, consent is not required for Florida. Yeah, we have like this whole I literally tell the kids, I'm like, shut up, you're gonna listen for 15 minutes.
They get everything about consent.
Really, I was like, I don't care if you forget everything else I've ever told you. You're going to remember this.
The one.
Yeah, they get, what else do they get? They get healthy relationships. They get partner negotiation skills. So they do role play. So it's like a whole thing. So I get them for 10 days if they do the whole program. So that's what we're doing. And like I said, we do see a really good number of students, but we still miss a ton. But it's interesting.
That's amazing.
Yeah.
It's very comprehensive, which is awesome and needed. Like that's I think that's part of the reason we're having this conversation, and the question becomes like, what's missing? Like when the kids are not getting that information, what are you seeing coming through your doors, you know, with like issues coming up, you know, like I know that probably could take a whole other hour to listen. But
yeah, you get so many different things. Like I've got students who are really bold and will ask the question. Like I had a student a few weeks ago in a class that was just like, Miss Jasmine, we'll be like messing around. I'll be filling up on her. And she goes, ooh, stop. But then she don't want me to stop. What's she mean? And I'm like, that's a great question.
Great question.
You know, so you talk about partner communication and mixed signals and partner check-ins. And I'm like, that's a great question. And then of course you get the kids who are like, semen? What is that? You know, and there's so many different levels of whatever. And, you know, there's so much missing, you know, and, you know, data shows us that there are less sexually active students than what people perceive. So that part is correct. However, what I can never wrap my brain around, they're like, well, they're not doing it, so they don't need to know it. And I say, okay, so how is an adult, even if they're a young adult, we still don't have resources. Like, it's not like, oh, you're 19, there's this required federal class for you to take. Like, you know, it's like, okay, so when do they learn it, you know?
And where do they learn it?
And where, you know, if that student doesn't go to a traditional 4-year university, chances are they're not going to learn it at all. And it's, you know, and if they're a commuter student, they're going to miss it. You know, so it's like, okay, so where do you meet these students? And so, you know, I think a lot of people are so naive and, you know, whatever, in the idea that, well, they're not doing it, so they don't need to know it. And I'm like, and this is how I end up with like 35-year-olds who have no idea, like, the basics about, you know, their vagina or where things come from, or, you know, basic hygiene. Like I've had questions, you know, for areas of the body. So there's a lot missing. And just a lot of misinformation, really, you know, and then really trying very, very hard to get like personal beliefs out of education, and just taking it for the education, not so much, you know, I don't know. I always tell my kids, I am giving you the information so that you can apply it to your life how it fits.
Exactly.
Right? And that's kind of where I go. But for some people, that's a really difficult concept. And, you know, for them to do based on their beliefs, like that's like not even an idea, like what, you know, so it's interesting.
I wonder, I have a question. Do you get a lot of kids, like maybe high school or middle school, I guess too, where they're saying like, well, but my parents said fill in the blank, like, does that come up?
Sometimes, absolutely, you know, so like, especially when you talk about like the definition of abstinence, right? You have like, well, my so-and-so said that's until you're married. Well, my so-and-so said it's until, sometimes I get ages, like parents or adults in their life that are like 18, 21. And I'm like, okay, those are your personal beliefs, right? And so you'll go back and say, you know, abstinence is a choice at any time in your life, right? A lot of people get abstinence and virginity mixed up. You know, so definitely I have a lot of people say that. Also in different communities, you know, even in the Hispanic community, you know, I'm Hispanic, there's a lot of myths surrounding sex as well. So when I have students that fall within those, you know, different communities, I do have to clarify a lot of things. You know, like when I was growing up, I was told that if you have sex, I'm gonna know. And you're like, how? What? How do you know? And the answer is, oh, your hips change. And I'm like, oh my God. Like, if I have sex, my hips are gonna like become, you know, whatever. And everyone's gonna know. So I remember like being freaking terrified out of my mind. I remember, you know, when I started having my first experiences in college, I remember like coming home on the weekends, like, I'm going to wear a bag over my body. I'm going to wear a bag. I am terrified. What's another myth? I mean, will you have sex and die? Of course, that comes up in various different versions still. if you're not married, or some part of your body will stop working properly, or just like
Or the virginity checks and things like that. Like that was a
oh
pretty
my
big
gosh,
thing
yes.
with T.I., right? Like that came out with his.
Oh my
Yes.
gosh, yeah.
That comes up a lot in classes. Will, not, I mean, I hope parents aren't, and, that's illegal. But yeah, like students asking, will my parent be able to take me to a doctor and find out? Yeah, it still happens for sure. And so there's a lot of myths and facts that, yeah, adults will tell children. One, I think it's that they don't know the correct information. They were told, never found the correct info, so it just kind of keeps going. But also, like you had said, Cara, like in your experience with sex ed in schools, it's still a scare tactic, right? So I'm not going to tell you how to prevent these things necessarily, but I'm going to show you some really grotesque pictures and scare you at least until you're like 19.
Right.
And you might be able, to like figure it out. And it's the same thing. And it just makes me so angry because I'm like, why do we do this? Like, you don't scare tactic them about anything else.
Yeah, and I'm glad you brought up the virginity thing too, because I think from the perspective of trauma too, for someone whose first sexual experience, if it included penetration, if it was a female identifying or a female body, and their hymen broke or whatever that was, like that was the thing that I heard a lot growing up, was that meant that you lost your virginity.
Yeah.
And I think it's still a huge myth that floats around today. But like, I remember when I worked in Florida, I worked with Jasmine at a youth agency, but I also worked at an organization combating sex trafficking. And my old boss there would speak about her experiences of being trafficked from a very, very young age, like very young, almost infant age, and being molested. And technically her hymen broke when she was a child because she was molested. And so we talked, it was the first time I ever heard someone talk about reclaiming virginity and saying like, I get to decide if I am a virgin or not, no matter what my past experiences were. And I thought that was the most fascinating thing that I'd never heard of. And I think it's such a empowering and powerful statement, particularly for victims of trauma, but also just to recognize that like a lot of the information we're getting about sex is social and not really rooted in anything scientific, when it's coming from like pornography or TV shows and movies, or like you said, non-medically accurate classes in school, or personal beliefs rather than what's actually written.
And that's so interesting. Even the hymen too, right? Like people, that's a social thing, right? Like if your hymen's broken, you're not a virgin. I'm like, do you know how many people lose? Like the hymen is something that eventually evolution will do away with. It's not needed. It's just extra. Yeah. And it doesn't serve any purpose. It's just there, right? And it just makes me so angry because I'm like, how do you know? Like, do you horseback ride? Do you ride in a car? Have you ridden a bike? Have you done any physical movement ever? Okay, well, it could have broken. And, some girls, some people, it'll break and they might think they're having a first period. Like they're spotting, and then they don't get it again, which is also normal for young people who get a first period. They get it once and it doesn't come back. And in reality, it was just this very little piece of skin tearing. And so I hate when people, are like, oh, well, hymen, blah, blah. And I'm like, leave that little piece of skin alone. Like, leave it alone. It's so frustrating. So, good point.
I remember in high school, the hymen was like a big thing of discussion. And like, for girls who were losing their virginity, it was like, oh, did you bleed? Oh, you didn't bleed? Well, then it wasn't your first time. And like, it was like this huge thing. And so many girls were like calling other girls like harmful names. And it was like, well, one of them's a horseback rider. One of them's on our equestrian team. Somebody does like rough sports. Like, and like, I was just like, guys, that doesn't make sense. But that's what the common thing is. If your hymen didn't break your first time.
Yep.
Yeah, and that penetration is like what I think a lot of people think of in terms of sex, when there's obviously tons of different, and I know in our part 1 episode, Jasmine, you broke down the different types of sex, but I think that's where the heteronormative views become really harmful, because then LGBTQ, I was going to say students, but just people, youth in general, are not getting information that applies to them sometimes. and then can lead to health problems down the road. And I think that's where our next kind of part of the conversation was going to go, is kind of how can we recognize and bring light to the sexual health disparities in marginalized communities? Why is there, are those disparities? I think we kind of already touched on that, at least with the LGBTQ population, but with like BIPOC folks and things, like what is causing the health disparities, and what are the things, like trends and things that you're seeing? And maybe not to like make this a huge meta, question, but like what can we do to, because obviously we don't provide sex ed at the Women's Center, right? But we do consent education, and we do talk about, healthy relationships, kind of like what you were saying within your program. And we get a lot of questions related to this. So yeah, throwing a huge question at you.
Like that's so crazy because, there's so many different disparities. And one of the biggest ones I think is starting sex ed from a young age. And everyone's like, what the heck? Like my toddler doesn't, and I'm like, listen, no, I'm not saying let's talk to your 2-year-old about STDs. And no. Like just like making things normal, right? Normalizing different things. So like that, quiz you mentioned you got in high school about labeling all the body parts, that should be done with your 2-year-old, and obviously not as extensive, but your 2-year-old should know the proper names for body parts, right? Like your 2-year-old, they shouldn't call the vagina a hoo-ha or whatever, or their penis a tinky winky. No, it's a penis, right? So starting there, having conversations about good touches and bad touches, and communication if there is a bad touch. I need parents to own that, like, even if you're helping your child take a shower, if your kid says no, say, okay, I'm sorry, you do it. Creating that privacy, like just because I'm your parent doesn't mean I need to watch you take a shower. Like, this is weird, right? Or even in the doctor's office, giving your child that space, like, so there's so many different things. So my first thing would be is just making some of these topics more normal, starting at a younger age. And then it also just helps build, right? And then I think also we need to start trusting our students more with information. A lot of times we don't trust students, and I always say, they will surprise you. Kids, they're pretty cool. They smell like kid sweat, and they're gross and annoying sometimes, but they can understand a lot more than I think we give them credit for. And so I always say, trust them with the information, and make the language simple for them, and be open to those questions. Some of the disparities, I think, it could be, when you talk about things like teen pregnancy or STI education, right? So you live in areas where there isn't sex health information, or there isn't a clinic where someone can go to. Different communities have fear of medical, providers and things like that. So that's how you end up with folks who have syphilis for years, and now they're our age, older, they're trying to have children, or just in general health problems, and we find out it was syphilis because they were afraid to go to the clinic when they were 16 or 17. Wow. So putting trust back into the medical community, and that's a big job, and no one wants to do it. Also I think we need to equip our teachers with better resources. If you're a teacher, to me, you should feel comfortable. So I realize not everyone is comfortable having these conversations, but providing those professional development opportunities for teachers if a student does come to you, especially after you have a guest speaker talking about these things, right, that they can open up to you, right? Because there's a lot of teachers that'll blow it off, or even when I'm in the classroom with them, they'll say, that's not appropriate. And I'm like, why not? When is it appropriate? Like, I'm here, like, as long as they're not cursing, fine. And even if they are, maybe they don't know the proper term.
Exactly.
So there's a lot of correction that needs to happen, but I think the narrative really just needs to shift. So we can reach some of those communities, and always having more health educators. And I say that everyone wants more of everything, but making it a priority. I've seen so many school districts that, not just sex health, but health in general, if it's not sports, it's not a priority. And it's frustrating because they say, sexual health, of course, I'm biased, that's so important. But, why are we just learning about hygiene in like 8th grade? Why are we learning about relationships maybe in high school? Or why are we getting them they're saying, oh, well, they get that in after school program. Well, if that student doesn't go to after school programs, they're not getting
access.
it.
Yeah.
And then we wonder why we have adults who commit sexual assault or are in unhealthy relationships. That behavior starts as young as middle school. It's not one day you wake up and you're an abuser.
Exactly.
So just teaching folks how to live better, opening up more resources, normalizing language and conversations. Like, the teacher shouldn't blush when I say penis in class.
Right.
Right.
Just normalizing that, and trusting students with knowledge. I don't know, did that answer the question?
Oh yeah, I mean,
Okay.
yes.
I was
Amazing.
like, oh wait, I'm going off. Okay.
No, everything you said was great, and it made me think too about the like really harmful stereotypes about different populations. Like, I was thinking one about like how people who identify as LGBTQ, there are stereotypes about promiscuity or risky sexual behaviors, and then that prevents them a lot of times from feeling safe accessing resources. And then similarly, with harmful stereotypes, like I remember hearing, I don't remember the statistics, you might know it, about the mortality rate for Black women in not miscarriage, of just
Childbirth.
of childbirth, thank you. Yeah, of just how, because of these really like old harmful assumptions that that Black people tolerate pain more or whatever, rooted from slavery, and how that still impacts people today, that medical practitioners will not give the proper treatment to Black patients that they're seeing. And it's just like,
Yeah.
Yeah.
We see that so much. There's so many stereotypes, like even within the LGBTQ community. I mean, we still don't allow them to donate blood,
Right.
based on, promiscuous behavior. And I'm like, have you talked to anyone who's had anal sex? Because it could be anybody.
Yeah, right.
Or if they're a part of the trans community, there's so many different things. So absolutely there. And yeah, in the Black community, Hispanic community, the mortality for moms giving birth is so high, for some of those reasons that you listed, and even just not believing them. So we have a lot of people who will give birth, and lots of things can also happen after birth, that they'll bleed to death, or if the placenta is not fully taken out after birth. We see that a lot. And it's interesting because as you go up with education levels with those women, it's actually higher. It's so bizarre. So you have educated, because people are always like, oh, well, that's those people, right? So using that non-inclusive language again, but it's educated, college educated folks, and they're still dying at so much higher rates because of our healthcare system. And then you've got communities, the Hispanic and the Black community as well, are more severely affected by HIV and AIDS. And people are always like, oh, well, again, those people. But when you look at culturally why that is, it does open your eyes a little bit more as to why those numbers are so much higher. But there's so many different disparities and resources that we're missing. Even with COVID, with the COVID vaccine, we're seeing a whole new crisis within some of those populations as well. And it's literally like some of the same stereotypes that are happening. And it's just like, when will you people learn? So it's sad, but
Yeah.
Mm-hmm.
Well, I don't want to end this conversation because it's so great, but I know we're getting close to the end of our episode and our conversation here. So I wanted to just open the floor if anyone had any other thoughts, questions, like comments, things they want to share before we start to kind of wrap up.
Anybody?
So grateful to have had this conversation. I feel like from the last, like our part 1, I was like, oh my gosh, I learned so much. And I just learned so much again. And I'm like, okay, so part 3, like when do we get to get, like, I want to do what you do. You just have this wealth of information. And that you said about like teachers need to be comfortable like having these conversations. Like it's just, it's so weird that like we're the adults in the room, because like it feels like 5 minutes ago I was in high school, and like being comfortable with it is important. And I'm thinking of like, I don't know, my family members, if they watch like this episode of Real Talk, they're gonna be like, oh my God, Sydney, like you can't say or hear those things. Like, what are you doing? And it's like, no, that's part of the problem. So I'm so glad that you brought that up. And I think it's really, really awesome that you get to go to work every day and be like, we can be comfortable talking about this, because it's like normal people stuff. Like, it's just very cool. So thank you.
Yeah, my favorite thing to do in the classroom is like, if I'll ask a question, and like anal sex is always the one no one wants to say. So I'll ask the question, and if the answer is anal sex, they're always like, and I'm like, guys, like you can say it, it's okay.
I hate that word.
Yeah, and if they're looking at me like really creepy, I'll say, okay, 1, 2, 3, all together, anal sex, and then they all do it together. So we have these moments of 1, 2, 3, anal sex, and it's absolutely hysterical. But then they get comfortable because it's just words.
You're breaking the ice.
Yeah, it's just a word. So we'll do that for all kinds of words that they are like, oh my God. But
so funny. Let's start part 3 that way with
whatever shouting out the word.
Yes. Yeah. So fun.
That's so funny.
So fun.
Holly, did you have any questions, comments, thoughts?
I just want to say thank you. I totally agree with what Sydney was saying, like just normalizing the conversation, allowing the conversation to happen. Because I can remember like growing up, I grew up in a Catholic family, and like it was just something you don't talk about. And it's still something we don't talk about. So my family's going to be like, why were you in a conversation about that? It's
right?
Normal. Like, this is normal. This is healthy to talk about. If you don't talk about it, what's going to happen? And that's where we're seeing the problem, is because there's no education, or not education, but it's not proper education. And we need to trust like the younger people to understand what they're being told, or not told, but like understand what's being given to them, and trust them that they're gonna take it and run with it. So
make informed decisions. Yeah.
Allow them to make the informed decision, but allow them to have all the information in order to make that informed decision.
And to make space for the conversations too. Yeah. Like I was talking about something with my younger sister. She's 20 years old, so she's not like, but we were having a conversation, and I was like, I'm the oldest. Like I wish I had someone older than me to like talk to me about this stuff with, because I couldn't go to like family members, older, like, I don't know, aunts, cousins, my mom, like without it being weird. But like I had that conversation with her, and she, whatever, but I was like, I wish I had that when I wish she was my older sister and we could have had this conversation.
Yeah.
Yeah, I think it's funny thinking about like the family kind of talks around these issues, like however you identify, because we talked a lot about like how we learned about periods or whatever and things like that. I think those are going to look different for however, your gender identity is and what those conversations look like in your families. But I remember conversations, and it was always very hush hush. We never talked about sex. That was just never a topic. It was very much like the school will teach you that, but then a lot of times the school is like, your parents will teach you that, and then it's like no, there's no connection made. And I think that's why we're going to do another episode of Real Talk at some point, talking about pornography and the messages that people get about sex from pornography, because I know a lot of my peers, when we didn't learn about it in school, they were learning about it from porn. They were learning about it from their older siblings who were watching porn. and all these different things. And I think relating it back to our issues at the Women's Center, like we do our puppet shows in kindergarten, first grade, and we do it's super cute. And we talk about safe touch, unsafe touch. We talk about the safety rules of like what to do if you get an unsafe touch or a confusing touch, the uh-oh feeling, you know, how to, you know, identify a trusted grown-up and things like that. And I always praise internally and externally, if I can, the schools who welcome it and want us to come in. And it's such a head scratch moment when schools are like, oh no, we don't want to, you know, talk about that stuff, because it's like, ooh. And obviously you still get the like kindergartners who are like, you know, when you're talking, it's like, of course, like, and when we do a boundaries in our bodies program for 4th grade. And when we say private parts, they're like, you know, and it's hilarious and adorable, but we do exactly what you're saying, Jasmine, of like normalizing it, like use the proper terms, because not to like depress people, but like child sexual abuse does happen. Sexual assault in middle school, in high school happens. And so not having these conversations is not only bad for their potential physical sexual health, right? And like just knowing how to take care of themselves, hygiene, STI prevention, etc., but also for sexual assault prevention and abuse prevention, that like, you know, we still get kids who are 7, 8 years old who say, my friend got an unsafe touch, what do I do? You know, and so it's like, if we're not talking about it as the adults, we're not creating a space that feels safe for kids who have experienced this. And it's just further silencing them. And then we wonder why a 38-year-old finally comes forward about their experience when they were 10 or 14, you know, and being like, well, why didn't they report it sooner? Because we can't even say penis and vagina in a class without, you know, I mean, it's just ridiculous. So I think this conversation is so, so important. And thank you, Jasmine, for coming back and joining us for part 2. And I totally agree, Cindy. I feel like we could do part 3, 4, 5. I mean, it's just, I wish we could do your whole 10-day, would you say?
That would be so cool.
That would be really cool.
I love adult sex ed. So great.
Fun.
But it's so important. And for anyone who's watching, you know, I'd be so happy to hear questions that you have, or like your maybe experiences growing up, about you learned about sex ed and what was missing, you know, what you got. So Jasmine, I wanted to give you the floor if you had any final thoughts before we wrap up. No pressure.
I guess I would just have to say that, yeah, you know, if you're someone who didn't get the information, or you're someone who's not comfortable and you need those resources, I mean, you know, I'm sure you guys give out contact information, you know, so just reach out to the Women's Center, you know, because it's never too late to learn about sex ed. Whether you've never been sexually active, you've been sexually active for years, you're dating, committed relationships, married, whatever, you know, it's never too late to learn about sex ed and learn about your body. And then, you know, also I think some people forget about sex ed as social pleasure. So also just learning about you and your partner. And if you want to know more about, you know, how to talk and say, hey, I did not like that, or hey, I liked that a lot, do it again. You know, just having those conversations and being comfortable with yourself and with your body and whoever your partner is or are, whatever, you know, to just be informed and know that as you get older, doesn't necessarily get easier to talk about, but, you know, that doesn't mean you avoid the subject, right? You know, from a health perspective, we want everyone to be healthy and safe, but also we want you, if you're gonna have a sex life, enjoy it, right? You know, if you're gonna do it, I would love for you to enjoy it. I don't want this to be a miserable, scary, you know, experience. You know, if you're gonna have one, you should enjoy it. So why not learn as much as you can about it? Ask the questions. You're not the only one who has the question, I swear. You know, so ask.
Yeah, awesome.
Go girl, you're the
Yes,
best.
I know. Claps to you. Yeah, that was amazing. Thank you. So yes, for anyone who's watching, again, these are pre-recorded episodes. Use this as your starting point if you know, want to have conversations and have questions, don't hesitate to reach out to us or your local like clinics and things if you're visiting or not visiting, visiting us virtually from another area. But know we're a resource to you, and educators like Jasmine, obviously she's in Florida, but educators like Jasmine are a resource to you. And let us know your thoughts, your questions, your feedback. Please share this episode with a friend, with your family, make them uncomfortable in the good way. And yeah, thanks for joining us, and tune in next week for our next episode. Thanks for listening.